Hi everyone, I'm Dr. Akhila, consultant fertility specialist to the Hospital Banjara Hills, Hyderabad. Today we are going to talk about some facts and some myths in IVF. So first let's start with the facts of IVF. The most important thing that we need to understand is the process of IVF, wherein the woman comes on the day 1 or the day 2 of her cycle. A scan is done, blood tests for hormones are checked, and after that, injections are given for about 10 days. Once the response is established, the follicles are of adequate size. We take the follicular fluid, which is called as the ovum pickup, and we take the eggs, mix it with the sperm, create embryos, and put these embryos back into the uterus. This is what is IVF. Now, it is very important to understand that the success of IVF is about 50 to at the most 60% and not 100%. And the other important fact about IVF is that it is time taking. It takes about a month to create these embryos. As in, not exactly 30 days, but to create the embryos, 10 days of injections, the pickup is done on day 12, and 5 days after the embryos are created. But the whole month is required in terms of the period. Yeah. So, next, after that, within the cycle, after that, sometimes a hysteroscopy or a laparoscopy may be required. If so, then another cycle. And in the third month, usually the transfer is performed if it is a frozen embryo transfer. Sometimes the transfer can be done in the pickup cycle as well if the hormones are appropriate. But most likely, this is the process, and you need to understand that it may take time for you to undergo a transfer. Sometimes, if there are fibroids, if there's endometriosis, we need to give agonist injections, which may take about 21 days, and then do the transfer. So these type of things can occur, and it is very important to understand that you should not lose patience in the meanwhile. The other fact about IVF is that not all people have to undergo genetic testing. If there are any hereditary issues, if there is a previous child that is abnormal, or if the age of the woman is more, then we can go for genetic testing of the embryos, otherwise, not really required. The other most important thing is just because an IVF is done, if it is successful or if it is negative, it does not mean that you cannot conceive naturally after IVF. There is every possibility that you can conceive naturally even after a positive or a failed IVF cycle, provided the criteria for natural conception are established. Um, During the process of IVF, we need to understand that it is not painful, but it is physically and mentally quite taxing to cater to all the appointments, to uh, maintain the timings, to strictly follow the prescriptions. It is not a very easy thing to do. Just have to be dedicated at it. These are some of the facts that we need to know. Alongside, it is also important that we understand the risks of IVF. So during the stimulation process, there could be a very important complication called as ovarian hyperstimulation syndrome, wherein there is more of fluid accumulation in the body. And to prevent that, we give some injections and some tablets, and but that is one of the risks of IVF. Also, if we transfer two embryos, the risk of twins is also there. And apart from all these facts, the important thing to understand is what are the factors that can cause an IVF to be successful. Importantly, the age, the weight of the lady. Very important that these two are optimized, and then when we go for the IVF cycle, the success is usually better. So for people who are older, the quality of the eggs is usually less, and when the egg numbers are less, the quality is also less. So we also need to understand that there is no measure for the quality of the gametes, be it sperm or egg. So sometimes when we don't get enough number of eggs, or we don't get enough number of embryo, or the embryo doesn't implant, we need to understand that there is some problem in the quality of it. These are all some of the facts of IVF. Now let's quickly understand what are the different myths that people have. So IVF per se does not cause any birth defects or genetic defects in the babies. IVF is now almost about 30, 40 years old technique. All the babies are doing very well. So there is no problem with IVF babies being abnormal. The chance of an abnormal baby is just as much as that is there even in a natural conception. IVF is only for older women, nothing like that. IVF can be indicated even in younger women who may have blocked tubes, or who may have had multiple failed cycles of IUI or other natural methods. The other misconception is that IVF is only for female infertility. The different causes of male infertility as well, that is less count, less motility in the sperm, or poor morphology, high DFI. There are plenty of reasons why male infertility also can occur. And IVF pregnancy does not always cause a multiple pregnancy or a twin pregnancy. So it all depends on how many embryos we transfer. And if we transfer two embryos, there is a risk of a twin pregnancy of about 25%. These are some of the things that you should know. Also, another important myth is that IVF pregnancy causes girl babies. Nothing like that. There is an equal chance, or an natural chance of whether it can be a girl or a boy. These are some of the myths. The other important thing that we need to know is stress causes, couples to go through IVF and become infertile. That's another misconception. Though decreasing stress levels is always helpful, but that does not mean that stress per se causes IVF for IVF. The other one of the important causes is blocked tubes for IVF, but that does not mean that that's the only cause for IVF. There are plenty of other causes, male factors, female factors, PCOS, poor reserves. All these factors are also there, wherein IVF is indicated. Age does not matter is another myth again. Age definitely matters. The younger the age, the better is the oocyte quality, and probably a better embryo which can implant. The other misconception is if IVF fails once, then there is no hope of conception at all. That is also a misconception. An IVF fails, it depends on at what step it has failed, that is, whether the egg did not grow at all, or the eggs grew but they were not mature, or there was a FERT failure, that is, the egg in the sperm did not need to create an embryo, or there were no day 5 embryos, or an embryo was implanted but it was transferred but it did not implant. These are multiple stages of IVF failure. At what stage it has failed is what we need to check and reattempt. Like I have already said, if an IVF fails, it does not mean that there is no hope of conception or a natural conception. IVF causes early menopause is another misconception. It's a myth. IVF has nothing to do with menopause. The other important thing that I want everybody to understand is that once we take the eggs, there are some couples who come and ask, do you take all the eggs and there are no eggs left with us? That's not the thing. Every cycle, there are some eggs that are recruited. We take only those many number of eggs. The moment you get your period, you get more or less the same number of eggs in the next cycle. These are some of the myths of IVF. Any questions, please? So, like I already mentioned, stress per se does not cause infertility and does not lead to IVF. But decreasing the stress levels, doing yoga, meditation, helps in your overall health development. Whether I infertility is causing stress or the stress is causing infertility, or it's both ways, is very difficult to tell. But per se, it is not that there is a problem only because you are stressed out. So there are plenty. This is called as a secondary infertility, where you've gotten pregnant once and you can't get pregnant again. We need to know why this is happening. Plenty of tests need to be done, blood tests, scans, and sperm analysis. Once these are established, we need to tube test. Once all these are established, we need to figure out if there is any reason why this is happening. If there is no reason, some treatment can be offered. Very important to understand that if you have had a cesarean before, is there any stenosis which needs to be corrected? Bed rest typically is not advisable. Complete bed rest is an absolute no in pregnancy. Routine daily activities have to be performed, especially if there is no other issue in your pregnancy. IUI, after IUI, the conception is just as much as any natural conception. There is no restriction with respect to food or activities or work after an IUI. So even after the first pregnancy is cesarean, the second pregnancy can very much be normal vaginal delivery, provided a few factors are established. There is no rule that one cesarean is always a cesarean. That's not the case. Thank you very much. So not all IVFs result in twins, which is what I explained. It depends on how many embryos we have transferred. If we have transferred one embryo, the success of a pregnancy is about 40 to 50%. If we transfer two embryos, it's about 50 to 60%. Um, it all depends on the number of embryos we transfer. And even when we transfer two embryos, the chance of pregnancy increases by about maybe 10%, but there is an additional risk of having twins, which is about 20%. So, in simple terms, if we're transferring two embryos for 10 patients, about five or six get pregnant, but one or two may have twins. The others are still with a single pregnancy. No, there is no research regarding bananas or curd. So you can eat a healthy diet, including fruits, nuts, vegetables, and some seeds. There are no problems because of IVF in children, and the IVF now is quite a bold technique. The first IVF baby has herself had children after that. All children born through IVF are as much normal as in natural pregnancy. The only difference being in the first 3 months, you have to take a lot more medicines than you would otherwise if it was a natural conception. That's the only difference. The chance that the baby can be abnormal is just as much as what it is even in a natural conception. So it may take about a month or 2 months, at the most 3 months, for ovulation to get established once you stop the birth control pills. How quickly it resumes back, It's a little difficult to tell. It depends on person to person, but it can happen even within the first 1 month. Infertility is not always related to age, though age is one of the most important factors for the success of IVF. Yes, definitely you can get pregnant at the age of 40 based on your scans and other tests. And of course, this workout. Thank you very much.